Frank Olson the night of his death.
It was probably to check me out and see whether I was handling myself and handling the situation, whether I was hysterical. And I'm sure they left the house feeling ever so much better because I had been gracious and hospitable to them, so that I must have played right into their hand and made them feel fine.
23 years later, how did you feel about that meeting?
My anger was unbelievable at how I had been duped for this length of time, and the anguish which was unnecessary.
Anyone who knew during all of those years never told Alice Olson the real story of her husband's death. She would discover it by accident more than 2 decades later. In essence, it was a 22-year-long cover-up. Lyman Kirkpatrick was Inspector General of the CIA at the time of Frank Olson's death. Kirkpatrick attempted to have those responsible reprimanded. He wrote a series of letters for the CIA director's signature. In the first he wrote, those responsible had shown exceedingly bad judgment. It was rejected by high agency officials. And 5 drafts later, it was watered down to bad judgment. And those responsible were told they should not consider the letters to be reprimands.
But had not the Olson case occurred within the secret confines of the CIA, would not this case have been a prosecutable case? Perhaps manslaughter?
I would think definitely prosecutable, and certainly from the point of view of Mr. Olson, why it should probably have been actionable.
If you had an opportunity to say something to either Sidney Gottlieb or Bob Lashbrook, what would you want to say?
I really don't know. Except to say that I believe that nobody has the power to intercede in people's lives in the way they did.
Frank Olson's suicide slowed down the CIA's testing of LSD and other drugs, but only momentarily. It would soon pick up again, and the guinea pigs were mental patients and prisoners. Here at the Federal Drug Hospital at Lexington, Kentucky, Dr. Harris Isbell would test LSD and other drugs on prisoners. And as a reward, they would be given the drug of their addiction. One of them was Eddie Flowers, then a teenage addict. He is now fully recovered and is a director of this Washington, D.C. Drug Rehabilitation Center.
I was 17 years old. I was there shortly when I discovered some people being able to receive drugs in payment if you became a member of this particular experiment program that they had.
It was really Alice in Wonderland. Here you were in a public health facility for drug rehabilitation. You're being given LSD without your knowledge, and as a reward for it, you're getting heroin.
Well, when I look back on it, I get angry. Because the biggest piece of me recognizes that I was used. Okay, that a weakness was capitalized on.
The CIA was not the only government agency interested in the possibilities LSD and other drugs presented for mind control. The Army Chemical Corps first started working with the CIA and then branched off on its own. It too tested drugs on unwitting victims, and a death would result. The case of this man, Harold Blower, a tennis pro, seen here with his daughter Elizabeth, is well known. In 1953, Blower was a private patient at the New York State Psychiatric Institute. He was given 5 injections of a mescaline derivative that was being tested secretly for the Army Chemical Corps. With the 5th injection, Harold Blower died. As with the Olson case, a 22-year cover-up followed, until finally the Army admitted the real details of Blower's death. Since the initial news stories of Harold Blower's death, close to 5,000 documents, previously classified, have been released by the Army and obtained by ABC News. They provide valuable insight into Army activities at the time of Blower's death and where the Army went from there with their own drug testing program. From a previously classified deposition of Dr. James Cattell, who administered the mescaline derivative, on the purpose of the drug testing, to produce symptoms similar to those that you see in schizophrenia, on how much the patient knew about all this. We didn't delineate all the possibilities of what might happen because then you contaminate your experiment. Cattell then relates that he never even knew what drug he had given Harold Blauer because of the secrecy of the Army experiments. We didn't know whether it was dog piss. This was secret. This was a secret. We weren't in on it. We asked Blauer's daughter Elizabeth for her reaction.
What? How can anybody react to that? I mean, that is so far from what you'd expect from a human being, never mind a doctor, never mind a professional specialist who's supposed to care about people's minds. It's unbelievable.
Other documents strongly suggest that the Army tried to defraud the courts when the Blauer family sued. This memo from the Judge Advocate General's office suggests putting all documents relating to the case in the Chemical Corps' procurement center. There, they would be beyond the subpoena power of the plaintiff in this action. This memo, written 6 months after Blauer's death, talks of insurance for a proposed contract at Columbia University for similar drug tests, and says these experiments occasionally may result in unavoidable fatality.
And what did it mean to you when you were first apprised of how your father actually did die?
It was worse than losing him in a very strange way.
A suit filed by Elizabeth Barrett against the Army Chemical Corps is now pending in federal court. Other Army experiments continued on mental patients around the country. Work done at the Tulane Medical Center in New Orleans involved several drugs, hallucinogenics, and electrodes implanted in the brain. The Associated Press reported in 1975 that the chief researcher on the program, Dr. Russell Monroe, said the experiments involved only monkeys and cats, that some researchers had branched out into research of their own on humans, that consent was always given by the patient, and that Tulane never gave the Army any kind of report. These are various progress reports written by Dr. Monroe for the Army and recently obtained by ABC News. We asked Dr. Monroe, now head of the psychiatry department at the University of Maryland, about his remarks to the AP.
I think it's a little bit of a distortion. What I meant by, or what I reported at that time was that we published the data. We would not give the Army the data and let them declare it secret.
From one of the progress reports of Dr. Monroe, a report of a woman who had electrodes implanted in the brain and was then given LSD and other drugs. She became agitated, cried, lapsed into a trance-like state. Felt as if she were about to have a convulsion, experienced waves of darkness and light, had bizarre sensations in her neck and legs, said somebody was trying to manipulate her body. At this point, Dr. Monroe wrote that the woman was obviously having paranoid ideas.
As a layperson, perhaps you can enlighten me. What therapeutic effect would the type of experiment that I just described have on a patient?
Well, the therapeutic effect would be indirect.
Was this patient aware that she was being given LSD?
Yes, I mean, they were told that they would be given some medication, and they should have...
Specifically LSD?
Well, we told them, I don't think that they would have even known what LSD was then at the time. They were told that they were going to they would be given some medications which might make them feel worse.
Dr. Monroe, what do you think the Army Chemical Corps was looking for in all of this testing?
They were looking for an incapacitating agent, an agent that would not harm the person permanently, but would incapacitate them temporarily. That seemed like a humanistic way to to wage a war, if war is necessary.
When James Thornwell was given LSD by Army intelligence in 1961, this time it was no experiment. This time the express purpose was to peel back Thornwell's brain to bear any secret within it. This time the Army had gone operational. Thornwell was an Army private stationed in Orléans, France. Classified documents were reported missing from his unit. Thornwell became a prime suspect. His 2.5-month interrogation included administration of sodium pentothal, hypnosis, isolation, and deprivation of sleep. Army documents obtained by ABC News refer to this interrogation as conventional. Despite this severe questioning, Army intelligence was getting nowhere with Thornwell, and it was decided to slip him LSD. For 16 years, Thornwell never knew what had hit him.
Tell me about the acid.
I'd rather not. It's a bad trip. It's a bad trip. That was a bad trip. I was all over the floor, climbing up and down the walls, and crawling under the table. And he kept asking me, where are the documents? And I said, I don't know. And he'd tell me, you know. And each time he asked me a question, I would end up on the floor in the corner. And this went on and went on and on and on and on and on. And I felt like my head, like I was inside of my own head. My head looked like the sun and the black holes they talk about on the sun. It looked like I had craters off in my head, you know, and I could see meters flying by, just big bursts of light just going by and burst. Every time they burst in color, the pain was so excruciating. Felt like somebody was sticking me with 1,000,000 pins, you know, just everywhere. Oh, it just...
I don't mean to put you want to stop for me?
I walked around.
You want to stop?
Oh, I can talk. I lived through it. I lived through it. I lived through it.
No charges were ever brought by the Army against Thornwell. He was discharged for psychological disorders. But an Army psychiatric evaluation of Thornwell obtained by ABC News, one which was done prior to Thornwell being given LSD, says of him, fairly cooperative, oriented, alert, and gave no evidence of psychosis or depression. From the Army's point of view, this type of LSD interrogation was a success. Documents recently obtained by ABC News refer to the exploitability of interrogation subjects, cracking them, keeping them off balance mentally, and providing an economical, speedy, and productive aid to interrogation. From James Thornwell's point of view, it was no success. Thornwell still has serious problems. He's run through 2 marriages. He maintains he can't hold a job, can't concentrate, has nightmares, and feels socially and emotionally isolated. Last October, Thornwell filed suit against the government in federal court. But because of the way the law now stands, it seems very doubtful that his case has a chance. By far, the most chilling experiments we have uncovered took place at this Gothic estate known as Ravenscrag, halfway up Mount Royal in Montreal. It now houses the Allen Memorial Institute of Psychiatry of McGill University. It was here that the CIA funded a series of experiments, severe experiments, the details of which have never been made public. A joint investigation by John Marks and ABC News finds that this was the closest experimentation to brainwashing that has yet been disclosed. The work was done by the Institute's then director, Dr. Ewan Cameron. His work, unprecedented in psychiatry, would consist of 3 areas which he called sleep therapy, psychic driving, and the ultimate, depatterning.
Well, he was certainly one of the most active and eager psychiatrists that I have ever met in my life.
Dr. Maurice Dongier, current head of the Allen Memorial Institute.
And of course, he would use all possible ways and means to make things go faster. In his psychic driving, so-called type of therapy, he would give the patient intensive electric treatment in order to make the patient regress deeply, become forgetful, and then he would attempt to implant new ideas in the mind of the patient.
Now, to a layman, it would appear that Dr. Cameron was trying to take the slate and wipe it clean, the slate being the mind. In other words, brainwashing.
Exactly, that's a very good comparison.
Brainwashing.
Yes, if you like.
Val Orlico of Winnipeg, Canada, the wife of a member of the Canadian Parliament, was a patient of Dr. Cameron's. She entered the Allen Memorial Institute because of severe depression. She describes for the first time publicly the LSD therapy and psychic driving treatment that she was given by Dr. Cameron.
I always used to look in the nurse's window to see what was written down on various things on the desk. And I saw my name on a form, and there was a prescription there, and it was for lysergic acid diethylamide 25. And I thought, what in hell is that? So Dr. Cameron came in the morning and administered the drug, and we were off. And then the drug began to take hold very rapidly because it was an IV injection, and things became very furry and very frightening, and had a lot of sensations that it's very difficult to recall. And it seemed to me that it went on for hours and hours and hours. I had several sensations. I was a squirrel in a cage. I was Alice who'd taken the wrong pill and suddenly grown very small, and I couldn't get off the bed, and what was I going to do? How was I going to get a pill that would make me larger again? And at least once, and sometimes 3 times a week, I had these injections for a period of approximately 2 months. And they were very, very frightening. They were very disagreeable. I thought it was all some sort of very different type of treatment, but certainly a helpful treatment for me. I didn't know anything else about it. Nobody explained it to me. Nobody ever asked me if I was willing to do it or anything.
He had this feeling that he would be able to get through the resistance of illness and to reach deep changes very quickly.
Did he?
I don't think that when you look at that in retrospect, the hopes that he had have been in any way fulfilled.
But Cameron would plunge on. The next step was what he called psychic driving. This involved almost endless tape-recorded messages and more drugs for the patient. Cameron wrote that this was the way to make direct controlled changes in personality.
I thought this was the coldest and most impersonal treatment that anybody could give to anybody in the world. And I became more and more despondent and more angry. I mean, my strongest emotions were hostility and apathy. And I finally began to think, I don't care about anything, nothing matters. I just became so despondent that I thought I can't live like this any longer. And I thought I would just go out and throw myself underneath the cars on McGregor. I stood on the curb of that street, and I stood there, and I thought, okay, go. Okay, go. And then I thought, what if you're not killed? What if you're just maimed? What if you don't die and you live and you can't even talk anymore? And I couldn't do it.
The most severe technique Cameron used was de-patterning. He described it as breaking up the existing patterns of behavior by means of intensive electroshock therapy with prolonged periods of sleep. He carried out these experiments in something he called the sleep rooms.
People in there were like babies. They cried and they were very disoriented. And we were very afraid of the sleep room. We used to walk very carefully against the side of the corridor that was opposite the sleep room with our backs to the wall when we'd go by.
Cameron used this combined sleep electroshock treatment on patients as long as 30 days. One patient he kept asleep for 65 days. Cameron retired, and his successor, Dr. Robert Cleghorn, ordered a follow-up study on the patients treated with Cameron's de-patterning method.
Showed that it was no more beneficial in its result than the use of more conservative methods.
But the follow-up study showed that 60% of those who had been depatterned still had amnesia for periods of anywhere from 6 months to 10 years. That's quite a memory loss, isn't it?
That is a memory loss. Indeed it is. It's I think, more than desirable.
In retrospect, does Dr. Cameron's experimentation and his treatment appear harsh?
I would say yes. I mean, this forceful type of approach that I was describing to you is definitely, it can be said that it's harsh.
I wouldn't call it harsh. I would say it was harder on the staff than it was on the patients, because these people had to be fed and they had to be cared for and they had to be given sufficient fluid and food and toileted and so on and so forth. It was a very difficult thing for the staff to follow these patients properly and see that they did well.
Well, I'm glad he was concerned for the staff, but I think it was harder on the patients.
What kind of long-term effect do you think that this treatment has had on you?
I have great difficulty concentrating to write a letter. I used to love to read. I can no longer read books. It really took away, at least something took away, my ability to concentrate. The other thing that has changed in me, I can no longer go into crowds. I get panicky and I have to run out. And that started when I was in the hospital. I have been informed by a doctor whom I see. He said, I think if you'd have had a more general kind of psychotherapy, this would all be behind you many years ago.
How do you feel about that?
Well, when I found out about the experimental research that it really was, I was really quite outraged. I mean, I couldn't believe it. How could anybody? I mean, I was just outraged. I was angry and I was outraged, and I thought, all these people who've been hurt and nobody was ever helped by any of this damn stuff and all the misery that I at least went through. And it was as though it was like a missing link. This is why I never got better. But damn it all, I wouldn't. I could have maybe had a different kind of life. And that makes me angry and sad, and I don't know how to explain how I feel, really. I just.
How did you feel when you learned that Dr. Cameron's experimentation was financed by the CIA?
Well, I thought, I can't even use the word that I thought, because I thought, that bastard. And he was too smart. He knew who he was working for. And, excuse me, but I just can't, sometimes I can't believe it. And yet I know it's true.
If you had the opportunity to say something to the people at the Central Intelligence Agency who financed this study, what would you say?
I think it's inhuman. I don't know what kind of people could cause this to be. I really don't. I feel very strongly about it. I realize the CIA is a very important organization and they have a very important job to do. But God, it surely doesn't have to be done on people who are totally incapable of knowing what's happening or having any defense against it. And I can't imagine the mentality of people who would do this. I just can't.
As for Dr. Cameron, he died in 1966 while mountain climbing. A colleague wrote of Cameron, "For him, the ends justified the means. And when one is dealing with the waste of human potential, it is easy to adopt this stance." Dr. Cameron seemed ideally suited for what the CIA had in mind.
A conditioned American who's been trained to kill and then to have no